Hey,
I,
hi, Dr. Lindsey and Wendy here. Wendy's getting ready to go on another one of her sabbaticals, get rested and rejuvenated. So we're doing a few videos before she leaves. And today we're going to talk about a younger guy. He's a 30-year-old fellow, who came in to see me when he was 26. I told him it was a little bit premature and it wasn't quite ripe. And what that means is that although we can do something, it's probably not advisable to do 800 grafts along the hairline. Let's wait until you need a little bit more hair, unless you're completely neurotic. I mean, occasionally somebody's so neurotic that they got to do something or they're going to do something stupid elsewhere. But I told this kid to wait, and he came in at 29 and a half, and we did, and here he is with holding his hair back. And you can see he's got some hair, but he's got nothing in that frontal quarter. And so we trimmed him down and packed it in. He packed it in there well.
Looks good, yeah.
He's got great hair to work with. And then he did a really good job cleaning. Here he is in the early post-op period. And then a month. And then he's 10 months out now. And typically 10 months is that sour spot, not the sweet spot. It's not fully grown in and people think it's all done. And sometimes it's not really growing until 10 or 11 months. But at 10 months, he's essentially done.
Yeah.
He may look a little bit better in a couple of months, but he rolled in because he's moving out of the area. And he did this little video, so take a look. All right, Steve, you're 10 months out from when we did this. We did 2,600 up front. And you going for you, I mean, that is a Brillo pad of thick hair. Going against this, I mean, you're really white and it's really dark skin. I mean, a really dark hair. Let me just get a pen to hold back. And that's really good. I mean, you look really quite nice. Bend over a little bit. You're still going to thicken up a little bit right there. Spin around and face the wall there, Steve. And so, let me get this thing in focus. So, getting close to you, your scar is right there. How much did I hurt you when we did this whole thing?
It didn't hurt that much.
It was pretty upfront with you. And,
you were honest, you're up front. Told me what to expect.
And anything you think anybody watching this video ought to hear.
You just gotta be patient.
Yeah. All right, man. Hopefully we'll see you in a couple months. So what do you think, Wendy? He looks pretty good.
He looks really good.
And he's 30 now, and he's got a hairline that'll age well.
Yes, similar to yours.
Right, and he's got I won't say an unlimited donor supply, but he's got a lot of hair.
A lot of hair.
And it's good hair, and it matches his scalp. And I think he really is an ideal patient. He was a little early and didn't rush to do something stupid and did his research, and then he did a good job cleaning, which is the other
follow instructions. Yeah, that definitely is. We definitely push our patients to clean and follow the instructions to the T, because it's both of us, right? It's the hair transplant clinic, and the patient has to do its part too.
Right. Yeah. Unlike facelifts, I've done about 4,000 facelifts, where it's really just me and the customer wearing their head wrap for the first couple of days.
But they still have to be compliant with that.
With hair transplants, it's me and it's you and it's the rest of our staff have to be on their A game every day, and then the customer has to follow the rules beforehand and not do stupid stuff like drink. We had a kid just recently that drank beforehand. It was oozy and it will compromise his result, and then they have to clean. So the good and the bad about hair is that it's really gratifying, and there's not a lot of people putting all those pieces together, but it requires us to be working, and it requires you, the potential or the actual customer, to follow those instructions. Okay, if you got any questions, please give us a call. Thanks.